Hi there, and welcome. My name is Jeff Bell, and on behalf of McLean Hospital, I'd like to thank you for joining us for this latest installment of our educational webinar series. We have titled today's session, When Perfect Becomes Problematic. And we're talking, of course, about perfectionism. Even more specifically, we're going to zero in today on perfectionism in kids and teens. Young people grow up with all kinds of incentives to strive for perfection, and there's no question that this drive often serves kids and teens well. But taken too far, it can also create serious mental health challenges for them. So let's sort all this out with an expert. Dr. Meredith Elkins is a clinical psychologist specializing in the cognitive behavioral treatment of anxiety, mood, and related disorders in children, adolescents, and young adults. She is currently a program director at the McLean Anxiety Mastery Program. That's an intensive group-based outpatient program for children and adolescents with anxiety disorders and OCD. Meredith, thanks so much for joining us.
Thank you so much for having me, Jeff.
So let's start with some basics here. Psychologically speaking, what is the definition of perfectionism?
So perfectionism is a fairly broad term. I think folks know that. It encompasses a lot of different behaviors and thoughts and tendencies. But if we think about it, I like to sort of specify that, perfectionism is relentlessly setting rigid high standards that are personally demanding and which are all often seen as kind of unreasonable to other people who aren't you. They're kind of like, why are you doing this? And then feeling upset when those standards aren't met. It tends to include, judging your sense of self-worth as really being based on your ability to strive for and achieve these standards. And we're going to be talking a lot today about the difference between adaptive perfectionism and maladaptive perfectionism. But a key piece of that problematic or maladaptive perfectionism is when there are negative consequences of setting such high standards, but you continue to feel driven to pursue them despite the high cost.
Is perfectionism considered a mental health condition by itself?
So it's not. And I think this is one of the reasons that it makes it a little bit difficult to study and to define because it's not a mental health disorder, right? So we can, do epidemiological research in the population where we can broadly clarify what is the prevalence of obsessive compulsive disorder or of, body dysmorphic disorder or social anxiety disorder. We can't do that with perfectionism. And another thing about perfectionism is that it is embedded as a symptom in so many different mental health concerns, and it's not always problematic, right?
Mm.
So we have a similar kind of naming convention problem that we do with the word anxiety. So think about, when we use the word anxiety, we refer both to that normal feeling that we all have, that we need to have as humans to be able to survive. And it can also be like sort of a shorthand for a disorder, an anxiety disorder. And the same thing with perfectionism. Perfectionism can refer to kind of a way that you view yourself, like I'm a perfectionist or I'm doing perfectionistic things. And it can be embedded within the sort of symptoms and criteria for mental health disorders. So it really represents a spectrum here. So I'm going to be like a broken record with this. Everyone who's listening is going to be really tired of me saying it's really about function. What is the behavior that's like perfectionistic doing for the person? Is it ultimately helpful or is it ultimately harmful? And how do you kind of tell the difference?
Yeah, that's a key distinction. And we'll be talking, as you say, a lot about that. One more question about vernacular. We sometimes hear
Sure.
perfectionism described as a personality trait. Is that accurate?
Yes and no. So, what is a personality trait? We know that it's this consistent pattern of thoughts, of feelings, and of behaviors that's unique to a person and relatively stable over time. So, in some ways, perfectionism can be viewed as a personality trait, but I have a little bit of a problem with ascribing perfectionism as a pure personality trait because when we think of our personality traits, it sometimes feels like immutable, like we just are this way and we can't do anything about it. And I disagree with that. A person may have tendencies toward perfectionistic thoughts, toward perfectionistic feelings and behaviors, but it doesn't need to be a life sentence, right? And it should be and can be addressed if it's problematic. So there may be a tendency, but I don't think of it as an immutable personality trait that you're a perfectionist, and if it's causing problems for you, just like, that's too bad for you, right?
I imagine this is a difficult question to answer precisely, but generally speaking, by way of perspective, what do we know about the prevalence of perfectionism, and maybe specifically with kids and teens?
You're right that that's a hard question to answer in a real data-based way because, we can't estimate, what is the what is the incidence of perfectionism in kids and teens. So really what we know about the way that we can best sort of understand perfectionism is by looking at the prevalence of disorders that are highly associated with perfectionism. So, we broadly know kind of prevalence rates of anxiety disorders, prevalence rates of OCD, of eating disorders, of obsessive compulsive personality disorder, of body dysmorphic disorder. I think that becomes kind of a proxy for perfectionism, for assessing, how common perfectionism is. But then again, those are only talking about the clinical presentations of perfectionism.
Mhm.
So what if we're talking about perfectionism that feels like it's mostly good, but maybe it's trending a little bit into a problematic area. So we just don't know what the prevalence is. We do know that the prevalence of some of these disorders, particularly, I'm an anxiety disorder specialist. We know that the prevalence of anxiety disorders in kids is increasing a lot. And just there was meta-analytic data that came out after the COVID that showed that, nearly between 1 in 4 and 1 in 5 kids globally was meeting criteria for anxiety disorders, or was at the very least showing elevated anxiety. So we know because of that it's extremely common. And then there are some kind of sociocultural factors that I think are leading more and more kids and teens to feel like this is, even if I don't inherently feel like I need to be a perfectionist, a lot of these behaviors are reinforced culturally. So I think all that is to say, we don't know, but we have reason to think that it may be increasing.
Do we know much about causes of perfectionism? Is it genetic, for example?
With most of the, everything is a little bit of nature and nurture. I wish there were some sort of like a, like a swab or a spit test or a blood test that can be like, yep, you are a perfectionist or something like that. And we simply don't know. And we don't know also what the causes are. But again, if we look at the disorders that are highly associated with perfectionism, we do know that there's some genetic component, right? We know that there's some like moderate heritability of anxiety and OCD, et cetera. There's a little bit of research that shows there might be some moderate heritability of perfectionism. We know, for example, that it's more common, it's a trait that's sort of more common in monozygotic twins, so identical twins, than dizygotic or fraternal twins. So that, gives us some indication that there's going to be a genetic component. But more and more we can't do anything about genetics, right? And we do know that there's a substantial cultural, familial, peer-based, home-based learning component to perfectionism. And that's what we can actually impact. So I'm more interested in that, in learning about, how might kind of the environment influence perfectionistic tendencies? And then what can we do as parents, as educators, as clinicians to kind of help shift that frame if kids are struggling with perfectionism?
One more question about environment. You talked
Yeah.
about the fact that that can be a factor for kids and teens in terms of their perfectionistic tendencies. It's often said that the world is speeding up. And I can't help but wonder if perfectionism is becoming more of a challenge because of that, or not necessarily so.
Mhm. One of the things that's come out in the past few decades has been this somewhat, it's almost this like farcical or even this perverse finding, which is that, kids from high achieving schools are now officially considered an at-risk group, given the mental health outcomes of these extreme pressures to excel. And when you think about that, it almost seems, you know, it seems really strange to be talking about when we talk about other at-risk groups, we're talking about like the most vulnerable children in our society, right? Kids who are growing up in poverty, kids who are growing up in neighborhoods that are really plagued by crime or violence, kids who have parents who are incarcerated, those are considered high risk groups. And then you have these kids from these high achieving schools, which, they typically come from like some of our most privileged families in the same risk category as kids in the foster care system. And I think that speaks so much to how these pressures to excel, we know that they can have impacts on kids' mental health. So I think that that's something, kind of like a hard pill to swallow in terms of where the data is taking us, but something that's really fundamental to our understanding of what is going on in modern society and in terms of modern expectations for kids that's shifting the narrative here and really impacting kids' mental health.
Okay, real key term that we need to zero in on, and you've already hinted at this, adaptive versus maladaptive perfectionism. Break that down with as much precision as you can for us, because I know this can get very confusing. So, for the purposes of our conversation today, what will we define as maladaptive perfectionism versus adaptive perfectionism?
It's a great question. I think it's really, really key to our discussion. So thank you for like stopping the Meredith train and like let's clarify this. So we can think of adaptive perfectionism as things that we really we want some of this, right? That we want adaptive striving. We want kids to be working hard and to be enjoying the process of applying effort, but to have flexibility with their goals. When you have a kid who's loving reading and who wants to read more and more, when you have a kid who, feels really good when they get a good grade or when, they're performing well in sports or, even when they're getting compliments for being like feeling like physically put together or, becoming more healthy physically, those are good things, right? So this is not that we're trying to eviscerate all striving. But I think what we need to keep an eye on is there flexibility within that striving? And is it is it focused more on effort or is it focused more on outcome? So again, we are not trying to obliterate striving and bettering oneself. That's really important. But what happens is when it gets sort of taken too far, when these standards are really clung to with this excessive rigidity despite the negative impacts on your life. So it can be unhealthy when it causes kids to become way too critical of themselves or of others. And I think that it's really important to pause here and think a little bit about how perfectionistic behaviors thoughts and feelings can be learned because it is so reinforcing to, you put in a bunch of effort and you get a good outcome. Like think about how good that feels if as an adult have worked really hard and you get a promotion, or as a kid, if you practiced really hard and, you were bumped up a level in, dance competition. That feels really good. That's reinforcing. So initially what can what can kind of kick off and start perfectionism is positive reinforcement. Then what happens is that if your sense of self becomes so associated with, well, I need to achieve X, Y, and Z in order to feel good, the behaviors that you're doing are basically done to avoid feeling bad if you don't do enough. So I'm doing something now, not because doing it makes me feel good. I'm doing it to avoid feeling bad. Does that difference kind of make sense? I know it can
It
be a little
does.
bit muddled, but then your perfectionistic behaviors really snowball because it's like, well, did I study enough for this test? Because if I don't study enough for this test, then I'm not going to get the good grade. Or did I work hard enough? Because, I know my parents are really proud of me when I work hard, but what if they're not proud of me enough? So the avoidance of the distress becomes more and more impairing, the harder that we like the kind of more we sort of identify with perfectionism. So I think that even perfectionism that starts out as adaptive, we as the adults in kids' life kind of want to keep an eye on when are the sort of costs of it really outweighing the benefits of it.
It sounds to me like there's an element of looking and focusing on outcome versus process here. Is that
Mhm.
accurate?
Yes, it is. And I think this aligns with a lot of the great research that's come out in the past, even more than a decade now, really about when we're looking into how do we increase academic excellence in kids. So again, this was mostly research that was done not in clinical populations, and by that I mean not in populations of kids who were necessarily meeting criteria for an anxiety disorder. But we do find that kids perform better ultimately, and have a better experience of learning when they're focused more on the process of learning rather than the outcome. And so I think that that's been findings that have been really well disseminated into the population. I think so many schools understand this and really want to integrate discussions about, the process is more important than the outcome. I've got a young child, and I know that her teachers, talk in the school because I hear her echoing this when she comes home about like my favorite mistake and things like that. And so I think these are really nice ways to kind of help kids build in flexibility about the learning process. But I think how we can integrate that into sort of our own experience with our kids if we're parents is by focusing more on doing hard things and persisting and persevering rather than you got an A or you made the soccer team or this, that, or the other. Yes, we are going to inevitably praise our kids for those things, and it is not bad to tell your kid that you are proud of them, right? And can we praise more than just the outcome? I think that it would be like broadening what we're giving attention to.
We have a lot of questions coming in for you that we will weave in here. I want to get to those in just a few minutes,
Sure.
many about particular strategies for parents and educators. But first, I want to ask you about sort of the different categories of perfectionism. As I
Mhm.
understand it, there are three primary categories that are often described. Can you walk us through those?
Yeah. So I think you hear sometimes in spaces where we're talking about perfectionism about self-oriented perfectionism. So this would be when you set incredibly high standards for your own performance. So whether it's in academics, it's in sports, it's in your social relationships, et cetera. Again, I'm an anxiety disorder specialist, so a lot of my kind of clinical examples are going to come from that population. So bear with me. But if I'm doing an assessment for a young person who's struggling with anxiety, and they're talking about and we're talking about issues of perfectionism. Is this coming up for you in your life? Sometimes if there's a lot of concern about like what other people might think about them, I'll sort of ask, okay, well, are you more concerned about do you want to perform or behave in this way because it feels good to you, or is it because you're worried about what other people would think? And a lot of times these kids will say, "Oh no, it's me. Like I need to keep working hard enough to do
Mhm.
this, or I don't want to offend somebody else, so I want to make sure that other people like me. These are my own standards." So we associate that a little bit more with worry that comes with generalized anxiety disorder. We also see this kind of self-oriented perfectionism in body dysmorphic disorder, which is kind of a cousin of obsessive compulsive disorder. This is the preoccupation with a slight or even like a slight real deficit or even just a perceived deficit or flaw in your appearance. So this is what happens when kids or adults might be like, I really hate my nose, and I spend a lot of time kind of with different makeup techniques to try to make it look a certain way, and I'm checking it a lot, or I'm engaging in skin picking behaviors or hiding it. It's when this one perceived deficit that is usually not really a deficit becomes this like a hyper focus, and there's a lot of sort of self-criticism. So I think those are sort of the clinical areas where we see more self-oriented perfectionism. And then there's other oriented perfectionism. So this is when you have incredibly high and rigid exacting standards for your environment and for other people in your life. So this is when you expect perfection from your friends, from your family, from your peers, from your coworkers. And folks with more other oriented perfectionism can be really critical of others who don't meet their expectations. And as you can imagine, this type of perfectionism is more associated with conflict and relationship problems.
Mhm.
We see this more in obsessive compulsive personality disorders, right? Which can't technically be diagnosed until adulthood, but you can start to see these traits emerging in the teenage years. And then finally, there's the socially prescribed perfectionism. So this is when you have a belief that others expect you to be perfect and they're going to criticize you if you don't meet their standards. So we would see this more, going back to that example that I gave at the beginning of this prompt. If you're asking a kid, so what feels so bad about not looking a certain way or not doing a certain thing? Is it your own standard or somebody else? It's like, oh, but if I don't do this, other people are going to judge me poorly, or my teachers aren't going to like me if I don't behave in a certain way, or my parents aren't going to think well of me if I don't do this. So this is more associated with social anxiety disorder. It's fearing the negative judgment of others. So those are kind of the three buckets, and they're not mutually exclusive, right? So was that your next question? I was
You
wondering.
anticipated my next question.
I
Yes.
got it. Yeah. So, it's not mutually exclusive. So you can have perfectionistic concerns that sort of fall into any of these three buckets. I think that it can sometimes when there are these types, we as parents can be like, okay, which one am I, or which one is my kid? I wouldn't trouble yourself too much about it. It's just recognizing that there are different ways that these sort of perfectionistic tendencies can play out.
I know that a lot of the parents in the audience are very curious about what they can be doing to watch for signs of perfectionism. Can you walk through some of the basic red flags, if you will?
Absolutely. With any mental or emotional health concern, what we want to really look at is behavior. So what is the person driven to do because of their perfectionistic tendencies, right? So you have perfectionistic thoughts, perfectionistic feelings and beliefs, but what is it actually making you do? So this is where parents can really look at their child's behaviors and think a little bit about, is this causing a problem for them? Is this impacting their ability to do what they need to do as a kid in a healthy way, right? Are they so concerned about their academic performance that they're just not getting enough sleep? Or are they so concerned about their appearance and kind of have these social evaluation concerns that they're spending excessive time getting ready and trying to look a certain way? Or they're spending a lot of their babysitting money on, makeup products or clothes or something to like look a certain way. Um, a kind of some sort of red flags, like if a kid is really struggling to make decisions, like they just can't choose. Do you want This is like the movie, what is it, like the Runaway Bride, where she doesn't know what kind of eggs she wants. Do you want like poached eggs or do you want hard-boiled eggs? And they're like, I don't know, I can't decide, right? Difficulty with decision making might be a sign that this is more problematic perfectionism, especially if it really is taking up too much time and they can't make snap decisions they need to make. If there's excessive reassurance seeking, they constantly need you to proofread their email to their teacher
Mhm.
or to double check their homework. They're checking in with friends, like, did I say or did I do the right thing? They want you to kind of review everything that they have written. Like you need to be the stamp of approval, or somebody else needs to be the stamp of approval. You see that a lot, and so that we might want to pay attention to. Excessive organizing and list making. Again, in moderation, organizing and list making is great, right? Otherwise, you kind of can't get your work done. But is it excessive? Is it multiple colors and coded in a way that's just taking so much time? Like making the list is preventing you from doing the tasks that are on the list. Giving up too soon if your experience isn't perfect. So this is really that black and white thinking of it needs to be all or nothing. So I tried, and if I didn't do well enough, I don't want to do it again, right? Um, we see kids who are struggling with perfectionism both spending way too much time on their academic work, for example, but also kids who are really procrastinating. And the reason for this is because I'm so overwhelmed that I need to do this perfectly. Like that's such a huge task, so I'm just going to put it off and put it off and put it off, because if it's not perfect, if it's not perfect, it's a failure. Some other concerns would be difficulty designating. So if you've got kids who are doing group projects and they're like taking on the whole body of work, they won't designate it to other people because they don't think it would be good enough. And that ends up being a problem both for them, but for their social relationships. Kind of not knowing when to stop, um, or alternatively, having really slow task completion. So they're erasing and rewriting their work over and over again so that it looks perfect or feels just right. General avoidance of anything that isn't going to feel just perfect. And then attempting to change other people, like having really, really rigid kind of scrupulosity, morality, sort of beliefs around how other people should act in a way that's sort of eroding their ability to make and form friendships. I think this is kind of a big thing in our culture, just more generally trying to change people so much right now. But really, like if you think about taken together, what is at the core of all this? The difficulty with flexibility. right? It is some rigid, entrenched beliefs. And so, yes, these are the things that you can be looking for as a parent, but also how can you, on the other hand, be modeling and reinforcing flexibility? I'm sure we'll talk more about that, but I just wanted to highlight that out of all these things that you can be keeping an eye on, at the core, it's where is your kid or where are you, right? We're not immune to this either, being really inflexible in your thinking and in your behavior such that it's making things harder for you.
That really does seem to be a common thread to everything that you've shared there. I want to project this forward, Meredith, in terms of what happens if these patterns aren't addressed. What are some of the longer term impacts of unhealthy perfectionism?
Yeah. So I think again, it's such a spectrum. So we see this adaptive striving that can be really helpful. But I think, if we play the tape forward, sometimes what we see is that the pressure just builds and builds and builds. And the ways in which perfectionistic behaviors have allowed kids to function and cope work great until they don't anymore, right? Trying to think of an example, but we do see, parents with the best of intentions who are really trying to help their kid excel academically, for example, or with an extracurricular, sort of uproot their own lives to ensure that their child can kind of like make it to the next hurdle. That's one of the problems with unrelenting perfectionism, is that the bar is constantly raised. And that's great if the child has the parent there or their like sort of support staff there to do all these things for them. But we often see kids struggle when that support's no longer there. So often for kids, this is going off to college. And when you can't just walk down the hall and say, Dad, I really need you to review this essay. Like, is this good enough? Can you help me make a more compelling case here? Because I really want my teacher to think well of me or to give me a good grade. Or they don't have they've been so rigidly focused on their perfectionistic challenges that they haven't built up the other necessary coping skills they need or life skills they need. They've been so focused on their academics that they don't know how to load a dishwasher or do their own laundry or call and schedule a hair appointment. That's going to impact them functionally because they've been prioritizing these more achievement oriented goals. And even just more basic than that, excessive perfectionism can just trend into a mental health concern, which it is, very treatable. We have wonderful cognitive behavioral treatments that can make such a big difference in the lives of kids who are struggling with perfectionism for any number of diagnostic reasons. And so I really encourage folks who are listening who are concerned that, their kid is struggling with maladaptive perfectionism to get a solid diagnostic assessment to figure out like kind of what is at the core of the perfectionism, and then to look into some treatments, because the functional impairment that can come from relying on these perfectionistic behaviors can be pretty significant, and we want kids to have some more flexibility.
Let's talk briefly about that treatment process. Are we talking about cognitive behavioral therapy, or what sort of therapy is used for these sorts of challenges with kids and teens?
Yeah. Disclaimer, I'm a cognitive behavioral therapist, which is cognitive behavioral therapy, or CBT, is the gold standard evidence-based approach to treating a number of disorders, primarily anxiety disorders, OCD, and this isn't just kids, it's across the lifespan. What we know about cognitive behavioral therapy is that it's very active. So it's going to be working on helping kids identify, what are the feelings that come up for you around these perfectionistic situations? What are the thoughts that you're experiencing that accompany those feelings? And then what are you driven to do because of that? And again, a few minutes ago, I talked about how important the behaviors are because the behaviors are really where you get the problems. If you are studying so much you're not sleeping, you're not seeing your friends, if you are so concerned about how people think about you that you will barely talk or you won't kind of take any risks because you don't want to offend somebody, et cetera. So we would work on, first of all, clarifying what the diagnosis was, like what the core fear was that was underlying some of these concerns, and then work to tap into it. And a key piece of addressing perfectionism, particularly in the anxiety and OCD sphere, is going to be a technique called exposure therapy. Um, Exposure therapy is based on the understanding that, you know, it's human nature to avoid the things that make us feel uncomfortable. So, for example, if I'm nervous that I need to make my English essay perfect, I'm going to probably, if that feels so overwhelming to me, it makes sense that I would avoid doing it. I would procrastinate. Or alternatively, that I would spend way too long on that essay to make it perfect. Both of those are ultimately avoidance strategies. They are ways that we avoid feeling discomfort in ourselves, either by doing too much or pushing it out. Exposure recognizes that avoidance actually fuels anxiety. And the more we actually give into kind of avoiding doing the things that make us feel uncomfortable or not doing the things that make us feel uncomfortable, we sort of have a short-term relief, but longer-term problems. So exposure therapy is really going to help the kiddo to focus on actually leaning into some of the things that feel hard. This can be a real challenge with perfectionism because a lot of times kids will be like, okay, well, if the thing that's getting in the way for me is, is that I need to make all of my assignments perfect, does that mean you're going to make me turn in assignments that aren't perfect? Right.
Mm.
And for them, that feels really values inconsistent. They're like, I don't want to do imperfect work, right? I like being the kid who has, excellent work. And everybody knows that, right? Again, this is why it's so self-reinforcing. But the goal of exposure therapy is not to just make you a trash student or like to make you a mediocre soccer player, but it sort of says, what is the cost to your life of having everything have to be so perfect? What would it be like if we could build in some flexibility around that? And so we might do some experiments like, I want you to turn in a work that has a couple grammatical errors. And again, for a kid with perfectionism, that might seem like, you know, like you just like put a bomb into I don't know, just like it feels awful. It feels so crazy that you would do that. But generally what's going to happen? Like maybe the teacher circles it and puts a question mark, and then it comes back to you. Like maybe you lose like a point or something, but their worst case scenario likely doesn't happen. And so we need to sort of poke the bear a little bit. We need to sort of test these kids' assumptions that if it's not perfect, all of these catastrophic consequences are going to happen. And through that, they learn, okay, so maybe there is a little bit more room for flexibility here. And that new learning that I can still produce good work or do good things without it being absolutely perfect helps them to have a little bit more of that psychological flexibility. And we do know that psychological flexibility as a construct is really at the core of so much well-being and benefit. It's actually like kind of part of treatment for all of these different mental health concerns, like focus on building psychological flexibility. So, all of that is to say that exposure work that's inherent in cognitive behavioral therapy is so helpful in being able to kind of build that psychological flexibility that we need to live, to live a full life.
We will circle back and talk more about CBT because it's so important, and we'll talk about the formal treatment process. A number of questions are coming in, actually, quite a few.
Okay.
And many of them have to deal with parenting and dealing with kids' anxieties around perfectionism at school. And so I want to weave a few of those questions in at this point. In a school environment, how can we help students push through moments of paralyzing fear of messing up, like everything is going to be horrible if I get a B?
Mm, right. Um, it can be helpful to sort of use, we call it Socratic questioning. Um, and I think that this a question from, I think it would equally apply to parents or educators. You should not, as a parent, feel like you need to be your kid's therapist. I just want to say that as a little bit of a disclaimer here, and back up for a second, because a lot of times when I do talks like these, parents want to know, how can I help? Completely understandable. But I do want to say that if your kid is struggling with perfectionism that does seem like it's clinically interfering, first and foremost, you should not be the person providing treatment for your kid. Right. And the same thing with teachers and educators. They shouldn't be in the role of having to provide cognitive behavioral therapy for their kid. That being said, there are some ways that, there are some suggestions for things that you might do to start sort of shifting, sort of to move the needle a little bit. So, for example, if we said, okay, so what's so bad about getting a B? Well, if I get a B, then it's going to lower my grade point average. Okay. Okay. And what would happen if your grade point average was lowered? Well, then, I wouldn't get into the college that I want to get into, and then what would happen? Well, then I couldn't get the job that I wanted to get to. And then, what would happen? So we're trying to kind of get them to sort of connect the dots with the core fear in the moment and these longer term outcomes. And through that sort of just curiosity and questioning, you can see that, how likely is it that this B is going to mean that you're living in a box under the underpass, right? Which is all often like where they'll get to. Like, if I can't get this, I won't get this. If I can't get this, I won't get this, and I'll be, homeless and abandoned and, unsuccessful. So it can sort of be helpful to play that tape forward for them and sort of be able to compare the relative unrealistic outcomes that they're thinking about. At the same time, we don't want to completely invalidate. It makes sense that you don't want to get a B because you care a lot about doing well and it feels good to get A's. And we want to say, like, what is the cost of this to you? If you get a B, but you were able to spend a little bit more time with your friends and in a way that was really meaningful, or you actually got the sleep that you needed so that you don't get the flu next week and you miss an entire week of school. We do need to help kids see the pros and cons and to recognize that some of their concerns in the moment are unlikely to have the long-term negative consequences that they think they will have. So that's kind of some cognitive restructuring that can be helpful to prompt. It's definitely something that a cognitive behavioral therapist would be doing with them in treatment. So to the extent to which your kids' concerns are really interfering, this could be something that you try with your kid, but you also shouldn't feel like, gosh, if I can't get them to like from between point A to point B through Socratic questioning, then all bets are off, because this should be something that you're addressing in treatment.
Here's a specific question from a parent who sounds frustrated that they're working on perfectionism at home, but having some issues in the classroom itself with educators. Just to quote part of the question here, it's hard to work with
Yeah.
my child on accepting life as a learning experience, only to have them go to school and have the pressures applied to them to get perfect grades, perfect attendance, perfect behavior, etc. Any thoughts on interacting with school staff?
I feel for you, because that is so hard. I know I mentioned, sort of the gratitude I was feeling with my kid's current experience of like, this is my our mistake wall or things like that. But that's not happening everywhere. I do think that, at the core of of cultivating psychological flexibility is identifying your values. So, talking with your kid as like to identify what your values are, both you as the parent. It sounds like you want to model and enact more flexible response system that values effort and growth and learning rather than outcome. And then saying, that's not, sometimes you're going to find that the values that you have are in conflict with the environment around you. And it can be, and just validate that it can be really challenging, because they're not always going to be aligned. And we as adults, we find that in our workplaces sometimes, right? That the values that we have, the things that we feel are appropriate striving may not be viewed that way. I think that it can be so hard for kids because they're sort of captive in this, school is their, basically their whole world. It's their academic world. It's their peer group. It's everything. So it can really be hard to feel like this is not the end all and be all. I would just call out that conflict, that we have a conflict between what we value at home as a family and the things that are valued in school. You're probably not going to be able to change the school. And so I think that all you can do is just reflect that there's that conflict, and then empower your kid to make their own decision for how do you want to manage this? How can I help you manage this? What's important to you here? But that is really frustrating when you're feeling like those values aren't being replicated across the board. And it does create, conflicting messages. I do think that parents may have similar concerns with how they look at, things around kind of social acceptability, body image, et cetera, when we're trying to be, kind of body positive, like love thyself with our kids, but everything that they're being served up on a social media platform, is perfect lighting, perfect filter, like unrealistic, unattainable. So again, I think just calling out these discrepancies, there's so much power in that. And sort of just being like, yeah, there's no easy answer here. So how do we want to deal with it? What do you value? What's important for you?
Makes sense. A viewer would like me to ask you about the phenomenon that might be known as participation trophies. Would that be an example of praising the process versus the outcome? Do you have any thoughts on such awards?
I do. I don't want folks to kind of come after me with your pitchforks, but we actually have some research that the participation trophies are like that sort of thing, not so good. Um, because I think then that is so much focused on like, look, everybody gets a trophy and feels really good, but it isn't tied to effort. Um, there's been a big debate. I don't know what other folks' Instagram feeds looks like, but mine shows, a lot of different debates about positive reinforcement. I think in many ways, kind of praising, reinforcing kids has sort of gotten a bad rap. And so you hear content creators saying, don't praise your kids, ask them how they feel about something, et cetera. Sticker charts are seen as sort of anathema. All of a sudden, this has become a really bad thing. And we very much understand where that criticism has come from, because we do find that when you reward, just for effort, I mean, I'm sorry, just for outcome, and not for effort, that can be difficult. But we do see that if rewards are not actually tied to they're not actually tied to effort and growth, then they don't really do much, and they can actually be problematic. So if you're somebody who loves a participation trophy, I'm sorry, I can't get on board with that, because the research just sort of bears out that it's not actually really great for our kids. I hope we steer a little bit away from that as a society, but also not have the pendulum swing so far in the other way that there's no praise, no rewards. I was leading a parent group a few months ago where a parent sort of sheepishly said to me, "I know you're not supposed to tell your kid that you're proud of them, but I did. I told him I was proud of him." And that, oh, like my heart just breaks for that. Like, please continue to tell your kids that you're proud of them. But don't just tell them you're proud of them when they get an A, right? Tell them that you're proud of them when they've persisted despite something being hard, right? Or when they had a really big challenge and they were super disappointed and they still got up the next day. So we can still praise and reinforce, but we want to do it in a flexible way. Sorry, that was a little bit of a soapbox thing. Whoever put that one out there, you got me. But I do appreciate that question, because I think it's a big deal.
Well, this can be very tricky for parents, certainly, all the way
Yeah.
around, and educators. You talked about, you hinted at the fact that parents can inadvertently be exacerbating the problem with their kids' perfectionism. Parents want to do the right thing, but oftentimes
Of
they can make some
course.
missteps along the way. Can you talk about some of those potential problems in terms of patterning for their kids, modeling for their kids with perfectionism?
I can. I want to be really mindful, because our discipline, I'm a psychologist, and, psychology, psychiatry, we have in some ways sort of a shameful history of blaming parents for
Mm.
kids' outcomes. Back in the 1940s and 50s, the idea of the refrigerator mother causes autism. And, so I think we need to be really, really cautious when we're talking about parent behaviors that may increase the likelihood that a kid struggles, but that, you are not, by and large, like, you are not the one cause of your kid struggling with perfectionism. That being said, there are some things that you can do that can make it sort of better or worse. So we both want to avoid blaming parents, but also recognize that, parents have a lot of power here to influence our kids' outcomes. So I actually find that really, really cool and really empowering. Some of these things that you may want to avoid, we've touched on a little bit. So being more focused on outcome rather than effort, we want to avoid that. That being said, you can still praise the outcome. The outcome is important to the kid, and it might be to you, but we don't want to do that at the exclusion of praising the effort, right? Especially the effort when it's hard or disappointing. Um, Having, really tough and exacting standards, we do find that there is some research that really harsh and perfectionistic parents, are more likely to have kids who have this maladaptive perfectionism, right? I think what was it in like 20, I want to say 2014, but that the battle hymn of the tiger mother, there was that the book that came out and really talked about this really holding kids to this really high standard. Um, and I think what is tough there is that those are parenting behaviors, that sort of tiger mom behavior, where it's a lot of demandingness and a lot of criticism, but without the warmth, right? It's good to have standards and expectations for your kids, right? Kids need a frame. They need guidelines, they need boundaries, they need expectations, they need consequences, natural consequences for problem behavior, and they need the warmth with that. So, if your kid didn't study for their math test and you were like, hey, you probably shouldn't go out, Saturday night and Sunday night because I know you got this big test on Monday. They do anyway, and then they don't do well in math. You don't have to be like, so I told you so. You can say, it makes sense that you feel really sad right now, like you care about this stuff, and we need to talk about what you can do differently next time so this doesn't happen. So you got to have the warmth with the expectations. It doesn't have to be one or the other. So I would be mindful also of like, what are you putting out there in terms of, I have to attend to this. I have to make this perfect. What are you showing your kids in terms of the relationship between, effort, outcome, and what you value in your own life? What does that look like in terms of how you manage work, how you manage your home, how you manage your body, how you manage, food choices? Because we are our kids, barometer of the world. So they are going to sort of notice and pick up on how we do things. So I think it's just a thing to be mindful of. You are not going to ruin your kid if, one time you're sort of obsessing over this work presentation that you have to do and they notice that. But we do want to be mindful of it because, parents do play a big role.
Sure. We also have a lot of clinicians in our audience for this webinar series, and I want to ask you to speak directly to them for a moment here. And I have a very specific question. Is there a danger when a clinician is working with a younger patient that patient might get caught up in perfectionism in the treatment process itself, whether it's for perfectionism or some other form of mental health challenge? Might that child get too caught up in doing it perfectly?
Yeah, I think this is a really really on point question, particularly in a very active treatment like cognitive behavioral therapy, where it's almost like a class. We give kids homework between sessions. We have stuff that they do during sessions. Sometimes there's stuff to read. And so as a clinician, sometimes you're like, oh my gosh, I have this kid. They're so engaged in therapy. They're like doing all the reading. They're like looking up extra things online. They're coming to session, having done all of these exposures, and they're so proud. And I think, as a clinician, we're like, yes, like they're into it. And that can feel so good. But we also need to be mindful of, okay, what's driving that? And calling it out and saying, I noticed that you did all these things. Tell me a little bit more about that. Because, I would wonder what's at the core of that. Is there a concern that the therapist won't like the patient as much if they're not doing these things? Is that the belief that's driving the perfectionism? A lot of kids who come in, to our offices with perfectionistic tendencies have these high need to please. So I would actually then challenge the clinician to build in some exposures to like disappointing the clinician or giving constructive criticism to the clinician. I think at one point I remember asking a kid who sort of fell into this category of like we designed an exposure where I was like, I want you to tell me, something that you think I could be doing better as your therapist. And that was
Mhm.
wildly uncomfortable for the kid and such a big moment when they were able to do it. And then to learn that our relationship didn't suffer as a consequence, right? So I think like noticing it, calling it out, and then I think that it's important to then again reconnect with the values. of like, what do we value in the therapeutic process? Is it more about like checking things off the box, or are there something else you want to get, and aligning it with goals? So.
We've had a couple of questions come in about relationships and challenges around
Mm.
those for kids and teens. Is it common for an adolescent with perfectionism and or OCD tendencies to have difficulty with friendships, for example? Any thoughts on that?
Yeah. Yes, I mean, I think this is if you're struggling with this, in your own life, in your child's life, you're really not alone. I think, um, perfectionism perfectionistic tendencies can really erode relationships, and this could be for a variety of reasons. This could be because the sort of relationships could be inadvertently built on these superficial things, like they only like me, my friends only like me if I, do X, Y, and Z, or appear X, Y, and Z. My teachers only like me if, for these same reasons. They can also erode if the perfectionistic tendencies are driving the child to spend so much time in the drive for perfectionism at the expense of building friendships, right? If you are struggling so much to spending so much time erasing and rewriting and redoing your notes after every class, that you're just like, what, I'm not going to go out. I'm not going to go to the homecoming dance this weekend. I'm going to work on this. So then you just lose the opportunities for friendships. And I think that when there's that more like other oriented perfectionism, where there are these high standards for other people's behavior and other people's performance, I think that then sometimes you fall into this thing of where kids are very quick to dismiss or just kind of cancel their friendships. And so then they end up with this like very narrow segment of, like-minded, like behaviored kids. Um, there's nothing bad with having a crew who, you feel really aligned with, but that doesn't necessarily serve them well in the long term, because we're all going to have to work and interface and interact with, people who feel differently than we do. And so these quick things of like, I don't like that you did this, I don't like that you do that, I don't like that you think that, that's not kind of in this realm of perfection. So therefore you're done, can really erode kids' ability to kind of form friendships. So it can be challenging in a lot of different ways. I'm sure there's a million other examples that could come to mind.
Let me squeeze in one more audience question before we
Please
start to
do,
wrap
yeah.
things up here. And this one, I assume, pertains more to teens. Are there connections between perfectionistic tendencies and substance use disorders?
I would say yes. I think that generally we think of substance use as an avoidance strategy. So I don't like the way so for example, in kind of maybe there's a social, I'm just going to give an example, social anxiety presentation. Um, I feel so uncomfortable in a social situation. I think everyone's judging me. I spend a lot of time, trying to be perfect, trying to say the right things, trying to look a certain way, trying to project myself as a certain person. But I still feel so overwhelmed. You know what takes the edge off? A beer, right? And so I think that the substance use can become this coping strategy to avoid the difficult feelings that come up with trying to, in this sort of perfectionistic cycle. So yes, we can see young people start to lean into substance use or other maladaptive coping strategies like disordered eating, like self-injury, right? All of these things that we know function as a maladaptive coping response. So absolutely, I think those would, be like big red flags for recognizing that perfectionism is driving these unhealthy coping strategies that can ultimately become disorders in and of themselves. That's not to say that all substance use or, self-injury, eating disorder, et cetera, is caused by perfectionism, but I would not be surprised if it were a contributor.
We've broached so many important topics around perfectionism today, and I know that a lot of our viewers are going to want more information. Do you have suggestions for resources, whether they're books or organizations,
Yeah.
where we might point people for additional information about this important topic?
Yes, and I think, one of the maybe the silver lining of the fact that perfectionism and its disorders like anxiety, OCD, et cetera, are so common means that we have a lot of research on these topics, which means there's a lot of resources. So there is a professor whose name is Roz, R-O-Z, Shafran, Shafran, Roz Shafran, and colleagues. And so they have an awesome book called Overcoming Perfectionism. I think it's the second edition. And then there's a series of free resources kind of aligned with that book. So if you go to overcomingperfectionism.com, there are free self-help books, there are internet, kind of self-help recommendations. It's great for teachers and educators too. There's a teacher manual and a student workbook. There are parent guides. This is a real wealth of free resources at overcomingperfectionism.com. There's also like a self-help intervention called Focused Minds. And it's for folks ages 17 and older who are interested in addressing their own perfectionism. And so that is, again, that's based on Shafran and colleagues' book, Overcoming Perfectionism, but you can find that at focusedmindsprogram.com. There's also CCI, which is the Center for Clinical Interventions. This is more of an adult-focused perfectionism resource. They have a ton of like free information sheets and workbooks that you can use. If you've got a younger kid, there's a book that that I like that's called The Girl Who Never Made Mistakes. And I think it's sort of just a kind of a picture book. It's probably good for kids ages like 4 to 8 or something like that. And it's about a little girl who is like known as the girl who never makes mistakes and who makes her mistake for the first time, and just how that flexibility opens up more joy for her. So I think that's a nice one for littles. And then the International OCD Foundation, so IOCDF, has a wonderful sort of resource center called Anxiety in the Classroom. And that has resources for schools, for parents, for families. I think particularly for educators, it has a lot of like videos and handouts for like, how do you identify anxiety and OCD in the classroom? How can you intervene? How can you have these discussions? So all of that is to say there's a lot of good evidence-based material out there. Look for things that are put out by there's a lot of information out there, right? So look for things that are put out by specific organizations that do this type of research, that disseminate evidence-based care, that take an exposure-based approach, because that's really going to be where I think you're going to find the most help. Yeah, I hope that's helpful.
Meredith, this hour has just flown by, and I want to thank you again for being our guest today. You have done a fabulous job helping us understand how perfect can, in fact, become problematic for kids and teens. Such an important topic, and we very much appreciate your time.
Well, thank you. Thank you so much, Jeff. And thank you to everyone who's here. I know it's tough to fit these things in. Life is really busy. So I do hope that this was helpful.
Dr. Meredith Elkins, to those of you watching, thank you for your interest in our educational webinar series. We hope you'll come back for future sessions, and we wish you a wonderful day.